So, you just had your wisdom teeth removed. Let's run through what you can expect over the coming days. First, you will have gauze in place following your surgery. We want you biting on that for at least 60 minutes following the surgery, at which point you can remove it. At that time, we are going to advise you start our over-the-counter pain management protocol. Typically, this involves giving ibuprofen as soon as you take the gauze out of the mouth. We start with 600 milligrams of ibuprofen. 3 hours later, we move to 500 to 1,000 milligrams of Tylenol, wait 3 hours, and then return back to the ibuprofen. This rotation is going to continue for at least 48 to 72 hours following the surgery. If you've been given any prescription pain medications, we often advise you substitute directly in for the Tylenol slot. Your surgeon will cover this directly after your surgery. Following wisdom tooth removal, you are going to be on a restricted diet. For the first day, we advise cold soft foods such as applesauce, yogurt, puddings, cottage cheese, or anything that is going to prevent us from having inflammation. From there, you'll be able to graduate up to mashed potatoes, mac and cheese, or a casserole that's easily cut with a fork. Following the first 2 to 3 days, we do want you to start advancing the texture of your food until you return to a normal diet within the 2-week window. At 2 weeks, you should be opening your mouth fully. Following most wisdom tooth removal, you are going to have sutures in place. Most surgeons do opt for a suture that resorbs on its own in 7 to 14 days. Again, you'll be directed specifically if your case differs. Following wisdom tooth removal, you're going to have 4 primary S's that you need to follow to prevent a dry socket. No sucking through a straw, no swishing, no spitting, and no smoking. If you want to add number 5 in there, it'll be no strenuous activity. We want you to lay low for 2 to 3 days following your surgery. If you've had your wisdom teeth removed under IV sedation, you are going to be required to have an adult or responsible party with you for at least 4 hours. We want to make sure that you're recovering well and the meds are wearing off correctly.